Welcome to Business English Solutions with Gifts, Chidi Omuta. On today's episode, we're going to look at some courses leading to Diploma Level 3 in Adult Healthcare and Diploma Level 3 in Health and Social Care. Today's course, the course we're looking at today is Responsibilities of Health and Social Care Workers. That's one of the courses in that particular program. But before I start, I want to read the disclaimer. The information provided in this course is for educational and training purposes only and is intended to support learners undertaking Diploma Level 3 in Adult Healthcare. While every effort has been made to ensure accuracy and relevance, the content does not replace professional judgments, workplace policies, legal requirements, or guidance from regulatory bodies like CKC. Learners are expected to follow their employer's procedures, current legislation, and professional standards when applying knowledge in practice. The outline of this course that we're going to cover include the difference between working relationship and personal relationship. We're going to describe different working relationships that we see in health and social care. We will describe why it is important to adhere to the agreed scope of the job role. We explain what is meant by agreed ways of working. We explain the importance of full and up-to-date details of agreed ways of working. And we explain the importance of working in partnership with other people. We identify ways of working that can help improve partnership working, and we identify the skills and approaches needed for resolving conflicts. Now, distinguishing between working and personal relationships. Working relationships in health and social care are formal. They're structured and governed by professional standards, policies, and legal requirements. When you go to the workplace, you are regulated. Whatever you do is usually formal. It cannot be what obtains outside the workplace, and it's usually structured. Both your tasks are structured, your communication is structured, your behavior is structured. So working relationship exists to support safe, effective care and are defined by clear rules, boundaries, and responsibilities. The focus is always on the needs of the service user, not on personal preferences or emotions. These relationships are time bound. It only exists when you are at the workplace. When you leave the workplace, you no longer enjoy working relationship. So, and it's task focused because you're there to complete daily tasks and shaped by expectations of your employers, regulators, and code of conduct. When you bring in your personal relationship into the workplace, you are getting yourself into trouble. That's why it's very important that you understand the difference between working relationships and personal relationships. Personal relationships, on the other hand, are informal. Is the kind of relationship we find at home, amongst colleagues, in amongst our friends, outside the workplace, and it's usually voluntary and based on emotional connections, shared interests, and personal choice. They are developed naturally. Personal relationships are developed naturally and are not restricted by professional rules or workplace expectations. We choose our friends, we choose the people that we relate with, we choose the people that we share personal information with. So, in personal relationships, individuals can express affection, share private information freely, and interact without formal boundaries. These relationships are flexible and centered on mutual benefit rather than on duty of care. Working relationships are centered on duty of care, but personal relationships are centered on mutual benefit. Let's look at the importance of the distinction between working relationship and personal relationship. You need to understand the difference. Blurring boundaries can compromise professionalism. safeguarding, and trust. A worker becoming overly familiar with a service user, such as sharing personal problems, accepting gifts, or meeting outside the workplace, can create dependency, misunderstandings, and even safeguarding risk. So maintaining professional boundaries ensures that decisions remain objective and that vulnerable individuals are protected. Imagine when you go to the workplace and you're gifted by client A and client B doesn't gift you. There is this natural tendency that those who gift you, or those that, share certain information with you, are the people that you take good care of. So it's somehow, that's why we must maintain our boundaries. It prevents conflict of interest and helps uphold both your own reputation and the integrity of your organization. So let's look at different working relationships that we enjoy in health and social care settings. We have four different working relationships. The first one is the relationship between colleagues or among colleagues, such as care assistants working together on a shift, nurses working together, teachers working together in a particular work period. This relationship is professional, is task focused, and based on teamwork, communication, and shared responsibilities. The second kind of working relationship that exists in the workplace is relationship between a worker and a manager or supervisor. This relationship involves accountability, guidance, and performance monitoring. So we usually have superiors, people that supervise our job functions. So they monitor us to see how we comply with the standard of the organization. The third relationship is relationship between care workers and external professionals such as nurses, social workers, occupational therapists, GPs. These relationships rely on clear communication, respect for each other's expertise, and adherence to confidentiality rules. When a care worker, for instance, is attending to a service user and you see something that is beyond your job description, the tendency is high that you have to call out the person that is responsible. You have maybe a skin breakdown, you're attending to a service user, you need to call the nurse in charge, or you need to call the social. There are certain information that we need to reach out to social workers with. So such a relationships is what we call external relationship. Then finally, we have relationship between care workers and service users, and this is central to the sector. This relationship must remain professional, must remain compassionate, and bound by organizational policies. So why is it important for us to adhere to the agreed scope of the job role? Everyone has their job rules. Why is it important that you adhere strictly to your job role? It protects service users, it protects our clients, maintains professional boundary, and ensures safe, high quality care. When each worker sticks to their task, the very task they are trained and authorized to perform, it reduces the risk of mistakes, legal issues, and harm. It helps individuals understand their responsibilities and limitations, reducing the risk of errors. Staying within your role also supports teamwork because other colleagues rely on each other to carry out their responsibilities correctly and consistently. So it leads to better outcomes for our clients and for the organization as well. What is agreed ways of working? Agreed ways of working are the policies, the procedures, and the standards that everyone in health and social care setting, or even other settings to other sectors, is expected to follow to ensure safe, consistent, and high quality care. They outline how tasks should be carried out, how information should be obtained and stored or recorded, how staff should behave in line with legislation, organizational rules, and professional codes of conduct. These agreed ways of working help to create clarity and reduce risk and make sure that all workers understand their responsibilities and the correct procedures to follow in the workplace. So while we are working, it's very important that we update our knowledge, update our skills, update the information that we have that that is guiding our work procedures. So policies and procedures are regularly updated to reflect new legislation, best practice guidance, and organizational changes. So relying on outdated information can lead to mistakes, safeguarding risk and breaches of confidentiality. They ensure that everyone in health and social care setting follow the same safe, legal, and consistent practice. If you're not up to date in the information that you have regarding your work, you'll be playing behind. You cannot operate, you cannot maintain best practice. The service runs smoothly when you operate with updated information, and risks are reduced, and care remains safe, person-centered, and compliant with regulatory standards with up-to-date agreed ways of working. So having current information also supports accountability and protect both staff and the service users. Why is it important that we maintain partnership working? Nobody works in isolation. We all work with people to achieve certain goals, the set goals of the organization. We work in partnership. So working in partnership ensures that support is coordinated. Your work is coordinated, is consistent, and centered on the needs of your clients. Effective collaboration leads to safe and holistic outcomes. For example, a care worker may notice a resident becoming unsteady and maybe shares this observation with a physiotherapist who can then assess mobility needs and recommend exercises or new equipment to be used. So working closely with families equally helps staff to understand their clients' routines, preferences, and triggers, which improve personalized care. When professionals, colleagues, and families communicate openly and respect each other's roles, problems are identified easily or earlier, and risks are reduced, and the person receiving care benefits from a more joined up and supportive approach. So what actually how can we really improve partnership working? The most important factor is clear communication. When you're working with others, you must provide good information at the right time using the clearest language and mutual respect. You must have mutual respect and be able to share understanding of your roles and responsibilities. In the workplace, we don't have people on the same cadre. We have seniors, we have juniors. So the senior workers must be willing to share their experiences with the junior ones. When workers communicate openly through handovers, team meetings, or shared care plans, they reduce misunderstanding and ensure everyone is working toward the same goals. So respecting each other's expertise also helps to build trust and encourages collaboration. Let's look at the skills and the approaches needed for conflict resolution. We work in places where conflict must emerge. How do you handle conflict? Resolving conflict in health and social care requires strong communication skills, active listening. When there is any conflict, you must be able to listen actively, show empathy, and remain calm. Have a solution-focused approach. We need to listen carefully to people's perspectives without interrupting them. Then acknowledge their feelings, show empathy, and clarify misunderstanding before trying to find a way forward. Staying professional and avoiding blame helps keep discussions constructive. For example, if two colleagues disagree about priorities, maybe prioritizing tasks on a busy shift, try to use open communication and agree to review the care plan together. It can help you to, to de-escalate tension. So approaching the conversation with empathy, explaining the reasons clearly, and involving both parties in finding solution can help to build trust and resolve conflict, quickly and help to improve productivity. Remember to like, share, and subscribe to our channel so that in the coming weeks, you'll be able to benefit from the next course that we're going to do. Until then, have a lovely time and bye.